A lot of you watching this video are probably relatively high-achieving students.
Have you ever been in a scenario where you barely studied for a test so you really thought you would fail, but then you ended up getting a 90?
Try and remember that fear, that uneasiness. Now instead of thinking about one test grade that would barely move your average, think about one sickness that could change your life. Yeah, pretty heavy, isn't it?
At 13, Sarah Braham bolted to her mom in the middle of the night, saying she couldn't breathe. Since she has celiac disease, a disease where gluten inflames her small intestine, her mom thought she ate something new, which upset her stomach. Sarah was sure that she was dying, so she was rushed to the emergency room.
However, the doctors couldn't find out what was wrong with her, so she was referred to a licensed clinical social worker. She was diagnosed with generalized anxiety disorder and somatic symptom disorder, which is not uncommon in chronic diseases. Sarah began cognitive behavioral therapy, which made her very frustrated.
For the first few months, Sarah's depression negatively impacted her social life, and eventually she went on anti-anxiety medication. According to Johns Hopkins Medicine, with generalized anxiety disorder, you are worrying constantly and can't control the worrying. But what about somatic symptom disorder? What's that? Let's find out. You might be unfamiliar with the terms somatic symptom disorder, illness anxiety disorder, and conversion disorder. However, you've probably heard of the term hypochondria. In simple words, that's when someone is constantly worried about the state of their health. That's the old school name, but now hypochondria is recognized as somatic symptom disorder and illness anxiety disorder.
Let's start by defining the disorders. Somatic symptom disorder is when a person hyperfixates on physical symptoms so much that it causes problems in their daily lives. They'll constantly have thoughts, feelings, and behaviors that stem from their real physical symptoms. Illness anxiety disorder is when someone is always worried that they are severely ill or will become severely ill. They'll feel uneasy with normal bodily functions like sweating and gas, but they may not have any physical changes. Conversion disorder causes physical symptoms that are not the result of an underlying medical condition, but rather stem from psychological factors such as stress and trauma. Let's break them down a bit more.
With somatic symptom disorder, the symptoms may or may not be associated with a diagnosed medical condition, but the person is experiencing real pain. They'll often assume the worst about their symptoms and frequently seek medical care, continuing to search for an explanation, even when other serious conditions have been ruled out. This leads to them feeling that their medical evaluation and treatment have not been adequate. So they'll repeatedly check their body for abnormalities and become concerned about the smallest things. People with illness anxiety disorder will either be care-seeking or care-avoidant. If someone is care-seeking, they'll willingly spend a lot of time in a healthcare setting, requesting several specialists and medical tests. If they are care-avoidant, they tend to avoid medical care because they do not trust doctors or think that they won't take their symptoms seriously. This can create more fear and anxiety. The person may not experience any physical symptoms, but will oftentimes exaggerate already existing symptoms and their severity. For instance, a cough becomes a sign of lung cancer, and they'll overshare their symptoms and health status with others. An example of illness anxiety disorder can look like this.
A woman named Dina recently visited her doctor. The doctor mentioned that tumors can grow at any time. When Dina returned home, she started feeling lightheaded with a headache, so she looked up what could have caused her symptoms. After reading articles upon articles, her worries grew. First, she was convinced that she had brain cancer. Dina did not have brain cancer or a brain tumor, but her later revealed illness anxiety made her think something was seriously wrong with her health.
While people with conversion disorder oftentimes experience depression or anxiety, excessive worrying and distress about the physical symptoms aren't a part of the diagnosis for conversion disorder. They'll have physical symptoms, and they most likely are a manifestation of neurological stress and trauma. Now, let's look at the causes and risk factors. The exact cause of somatic symptom disorder isn't clear. There are genetic and biological factors such as increased sensitivity to pain or having a family history of anxiety or depression. The environment can also play a role, and oftentimes your childhood and how you grew up comes into play. Having experienced past trauma, such as childhood sexual abuse or serious illness, or having a lower level of education and socioeconomic status are considered risk factors for somatic symptom disorder. In order to diagnose, there is an emphasis on the severity of the thoughts, feelings, and behaviors related to the illness. Similarly, illness anxiety disorder can stem from a multitude of factors. The cause can range from the way that the person worries about their physical sensations to childhood trauma, such as childhood abuse or neglect. Some warning signs to look out for are being overconcerned with your health, thinking a minor symptom is a serious illness, constantly checking your body for signs of illnesses, and WebMDing your symptoms. It is officially diagnosed when someone experiences health anxiety for at least 6 months, even after tests show that the person is not sick. With conversion disorder, causes include having other mental illnesses such as anxiety, depression, childhood abuse, or a recent stressful or traumatic event. Oftentimes, there can also be a related health condition that can trigger conversion disorder. People already suffering from neurological diseases such as epilepsy or migraines, or have family members with the neurological conditions are risk factors. And, like the others, childhood trauma neglect can be a cause for the illness. Neurologists or psychiatrists can diagnose conversion disorder by using physical and neurological exams, diagnostic tests and scans, including blood tests to identify toxins and poisons present in the immune system, CT scan, EEGs, and MRIs, to name a few. To be diagnosed with conversion disorder, one must experience all 4 of these symptoms. Experiencing the symptoms related to your brain's control over your movement or senses. 2. Experiencing symptoms that are not consistent with recognized medical conditions. 3. There is no other explanation for your symptoms, such as another medical condition or mental health issue. 4. The symptoms disrupt your life, especially your ability to work, have relationships, etc.
These disorders are more common than one may think, especially considering the fact that these statistics are only derived from the diagnosed and reported cases. Somatic symptom disorder is somewhat common and occurs in about 5% to 7% of the adult population. It usually begins by age 30 but can occur in children, adolescents, and adults. People who are born a female are 10 times more likely to suffer from somatic symptom disorder than people assigned male at birth. Illness anxiety disorder is much less common and affects about 0.1% of the American population, where it affects men and women equally. The peak age of onset is between 20 and 30, but can also affect all genders. About 1 to 5% of people who are diagnosed experience illness anxiety disorder throughout the entirety of their lives. Conversion disorder is 2 to 3 times more common in females than males, and 2 to 5 out of 100,000 people are diagnosed with conversion disorder every year. About 80% of adults with conversion disorder will stop working because of their symptoms, but it's important to note that anyone throughout their life can be diagnosed. Different age groups respond with different symptoms. People aged 20 to 29 most likely experience seizures, but people aged 30 to 39 most likely experience other movement-related symptoms.
Here's Jessie's story. At 13 years old, she hurt her back walking down the stairs at school. She went to Instacare to get x-rays, but the x-rays didn't show anything. Her pain worsened and she started feeling a shooting pain down her leg. Jessie went to go get an MRI, but the MRI was inconclusive as well. So she was given steroids and painkillers to manage her pain. Within a few days, Jessie became paralyzed from the hips down. She went to a primary children's doctor and got many more tests done. Eventually, she was diagnosed with conversion disorder. She worked with the hospital pediatric rehab to help her brain relearn how to send proper signals to her legs and regain movement and feeling. After rehab and recovery, she returned back to a normal life. Treatment efficacy, like for all illnesses, depend on the person and how they respond to that specific thing. The range of treatment options for the 3 illnesses are very similar. Medical intervention is used to help control symptoms to allow the person to function as normally as possible. Cognitive behavioral therapy, a psychotherapy, can help the person change their thinking and behavior and learn ways to cope with pain or other symptoms, deal with stress, and improve function. Antidepressants or anti-anxiety medications can be useful if the person is also experiencing significant depression or anxiety.
I mentioned something before about chronic illness. What does chronic mean? Well, chronic means that something is experienced over a long period of time, sometimes even your entire life. In people with somatic symptom disorder, up to 90% of cases last longer than 5 years and are usually a chronic problem because therapeutic interventions only yield small to moderate effect sizes. Similarly, illness anxiety disorder is usually long-term, unless psychological factors or mood and anxiety disorders are treated. On a happier note, people with conversion disorder recover within a few days to a few months. Most people who suffer from conversion disorder will not experience their symptoms again.
So what can you do to help a loved one struggling? The best thing is to just encourage your loved one to consider professional medical help to help cope with the thoughts and behaviors. Sometimes, providing reassurance can make things worse. This can be frustrating and cause stress on families and relationships. There should only be one primary care provider. This helps avoid having too many tests and procedures done. Thank you, and I hope you learned. Boo-doo-doo-doo. Boom.
No more boba.
Abnormalities.
Emergency room.
Disrupt your
I'm trying to record something!
all genders and ages. people who suffered from
stress and trauma. I'm getting stressed from this.